YouTube! Hello one, hello all, it's Amy, and I am sorry, I tried to make that fancy new phone I showed you. Still learning it. I sent that one picture from the hospital right before surgery, and I just tried twice, twice times. Two additional times, and I was unable to get it to actually upload to YouTube, so here I am, back with the camera, in my wonderful, spectacular bathroom. I should show you this bathroom sometimes because it's a master bathroom and it's the size of a box. Anyhow, that's neither here nor there. I'm doing well, doing great. I came home Tuesday. I had my surgery Monday, May 16th, and I came home Tuesday, May 17th in the evening. I did very well. Doctor said my liver looked great. I did pretty good. And so I came home and I have my mom, thank you mother, and my Aunt Alala, thank you Auntie Alala, my Aunt Linda, who came and helped me and helped with my daughter because she's 2.5 and she's kind of a mama's girl and she's always wanting to be with me, so they were helpful with that. Anyhow, so anyways, the surgery went great. It's spectacular, and you know, I was just telling my husband this morning, I had surgery. It still hasn't hit me, I don't think. I think, you know, all this rush and excitement and anxiety of getting up to the point where trying to get the surgery and doing the surgery, everything done for it, and every moment was so exciting, and it was a step closer, I knew what I wanted, I knew, you know, all the consequences and the risk and all that. Anyhow, and it's like the last 2 weeks were like a haze. It's just like it happened, and I don't think I was in it, I was just above it, you know what I mean? It's a trip to think about it, but I had it done and I feel great. I'm getting used to all the feelings, very different feelings. I'm still not quite sure of the fullness, but I've stopped when I think it might be the fullness factor. They described it as pressure or cramping, and so I stop when I feel any type of uneasiness. And of course, I'm getting like 1.5 ounces down of like food or something at a time. So, but interesting feelings. I do feel a little different on the inside, as far as I can feel a little bit of the feelings are different. The hunger, and I haven't really been hungry, you know. I went, whatever it is, 48 hours without food. I did my swallow test first thing in the morning. They do the bariatric patients first. I did my swallow test first thing in the morning, but they didn't have anybody read it until almost the afternoon. And I begged for my nurse, and she said, well, if you were sick, we would have seen signs if you didn't pass the swallow test. So I begged her to take, if this is TMI, the Foley out, like, immediately. And then I immediately put on my own pants, and then she came in and said I passed the swallow test and gave me my little sips of water I could have, and took out my pain pump and everything. And I said, can I put on my tops now? So every time somebody came in after that, they were like, are you going home? Because I was fully dressed, and I'm okay, I'm ready to go. And so I did see my surgeon that night, Tuesday night, and asked, and he said, you're doing great, and sure, and he told me what to keep signs of, anyhow. So I don't know what to say and what not to say, because I'm sure tons of people, I mean, the post-ops have already been through this, the pre-ops, you know, you probably already heard all this from the other post-ops, but I'm doing good, and thank everybody for their concerns, or, you know, their messages. I haven't been making comments, I've been watching, I'm a little behind, but I'm trying to catch up, and so I really appreciate all the comments. There's a wonderful lady who, just subscribed and has been watching and commenting, and her words are so wonderful, and she's been such a great lady. Miss Skinny Britches, thank you. And there's BSG and me. She's always, you know, wonderful with comments and stuff. That's Dana. I think it's BSG and me in 2011. Anyhow, all of the people who have been making comments, it's been awesome, and concerns, and I'm sorry, I should list everybody. I shouldn't just list a couple, but thank you. I very much appreciate it. I'm doing good, and I tried to make videos on the phone, and I will figure it out, because I think it's easier than the camera thing. So I'm doing good, and I did have one of the nurses from the program and the psychologist from the program come over Tuesday afternoon, and um, talked to me, and they were like, explaining lots of stuff that you hear over and over before you go home about the feeling of full, watch how much you eat, you're worried about the liquids, not about the protein. And I am trying to get the liquids in. I really am. But sometimes even drinking the cold, or not cold, but cold or warm water, any kind of water, I feel like a little tightness. It's interesting. Um, but water goes down. It's just, anyhow, it's all going to change again in like 2 weeks. And then again in 2 more weeks. And with each stage, it'll change. And it'll be interesting at each stage until I'm to where I'm eating a regular diet. Anyhow, the point of saying the nurse and the psychologist, they came in and talked to me and said, don't weigh yourself. We're not going to weigh you before you go home. Don't ask to be weighed before you go home. You've gained weight. We've pumped you full of fluid, especially since we made you drain out all the fluid before you came in. And, I understood all that. And I said, I'm not going to weigh myself before I go home. I'm not going to weigh myself when I go home. I don't want to set myself up for a mental, cascade, if you will. If that would happen, I don't know if it would, but I didn't want to put myself in that position. The psychologist said, just wait 2 weeks. You can weigh yourself every week after that or every month after that. She said, but just wait the 2 weeks until your follow-up visit. Don't weigh yourself. Come here, have yourself weighed, and then go home. And I guarantee you'll be very satisfied and happy with the number. And I said, okay. And I'm here to admit I weighed myself multiple times every day prior to the surgery because I was really wanting to lose the weight for the surgery. But I don't want to be in that habit at all. It's not about how many pounds I lose. It's about how good I feel, how I'm living differently, how I'm changing the habits, and the weight is, of course, the benefactor of all that. So I don't want to weigh myself every day. So I think I've decided this in my head. I will weigh myself after the first 2 weeks, every week for maybe the first, 4 to 5 or maybe 6 months. And then I think after that, I will just weigh myself once a month. I think that would be the best thing. And so I'm waiting 2 weeks for my a weigh-in after surgery. But my pre-op weigh-in was 290 at my pre-surgical visit on the Wednesday before my surgery. And then the day of my surgery, they weighed me on the bed. And so it was 292. I don't think I gained 2 pounds because I didn't eat different. I stayed on the pre-op diet. But I think that there's a difference between, scales within 2 pounds, and I'm okay to accept that. So that's my spiel. I'm going to be, not this Monday, tomorrow will be my 1 week. And I'll make a video between now and the time I weigh. But I have my family here, and my daughter, who's being very much wanting her mommy, trying to figure out how to help her understand that I can't carry her right now. She can't, sit on my tummy and play on me and stuff. Excuse me. Anyhow, so I will make a video though, and thank everybody for all their words and support. I really, really appreciate it. And this is probably super long, but what's new? It's me, and yes, I just got out of the shower. So thanks. I can't thank you enough. And I wasn't out, obviously, at the Las Vegas meet and greet, but I hope it went fantastic. And maybe next year I'll get to see all you fabulous people. And ta-ta for now. Best wishes, everybody.